Uptake in hand, foot, and mouth cases in northern Wisconsin. We thought it would be helpful to share information that may help you avoid getting sick. And joining us this morning to give us some tips is Nurse Christina Paris from the VA. Good morning to you.
Hi, good morning.
So good to have you here.
Thank you.
So what exactly is hand, foot, and mouth disease?
So if you ask the teenage daughter of my best friend, she would think that it's something really disgusting you get from a gym, but it's not. It's actually one of those childhood illnesses that most people get. It's similar to like roseola and chicken pox and that kind of thing. It's a viral infection, and it can cause skin lesions in your mouth, on the palms of your hands and the soles of your feet or on your feet. So that's why it's called hand, foot, and mouth. Yep, it's typically, you're the most contagious the first week that you are infected, and it often happens in the summer. But again, like everything that's thrown off because of COVID and the masking and it's a little later this year.
Right. Well, that's really interesting. So what are some of the symptoms that somebody should look out for?
So like I said, you're going to see a red rash that can be on your palms, and it won't necessarily itch. It can also, you'll see blistering on your the soles of your feet, and sometimes on babies' bottoms will have it too. They'll be kind of irritable. They might have a fever, poor appetite, sore throat, headache, things like that. So you kind of want to look, and even you can get it in your mouth too, you know, on the lining of your mouth, which would make it difficult to eat. For little infants, difficult to nurse.
Oh, no, poor things.
That's really tough. Well, how is it treated or how is it prevented?
So, yep, it's treated, it's viral, so there's not much you can do except kind of ride it out. If your baby you notice they're not having wet diapers, if kids are becoming really irritable or have a fever, you can treat that with Tylenol, but definitely talk to your pediatrician. Now, it can occur in adults too, and older kids. Not as often, but it can. So you want to just make sure, you know, when you're coughing, you want to cover your mouth. And then also, if symptoms haven't improved in 10 days or more, you want to seek help. But again, good hand washing, using those alcohol-based hand sanitizers, avoid touching your face, and clean and disinfect things in your house. Make sure you're wiping down all those common surfaces that we use all the time, the doorknobs, the kitchen counters, things like that. You want to keep all those things clean and disinfected.
Perfect. Oh, wow, those are really good tips. I feel like a lot of people, no matter what, it's really hard to not touch your face for some reason.
Yeah, that's a hard one for me too.
So that's really interesting. I am working on not doing that myself. So that's really interesting there. Well, thank you so much for telling us about this. And
absolutely.
I'm sure that it's going to help some people out there try to avoid that even more.
Right, stop the spread.
Absolutely. Well, we hope you have a great day.
Thank you, you too.
All right.